Hi, all. We're just about getting started. We're going to wait for a few more folks to join, and we'll get started in the next 2 or 3 minutes. Thank you. Okay, so let's get started. I want to start by thanking the panelists for joining us today, and the audience, which is comprised of interested citizens, lawmakers, and others who have taken time out of busy and hectic schedules during COVID-19 to join us. A few housekeeping items before we begin. We are recording the webinar today, which will be accessible on demand on our website with closed captioning. So if for some reason you need to tune out or would like to share it with someone else, you'll be able to do that later today. Our audience will be on mute for this entire webinar, but there is a chat feature on all the mediums that this is streaming on. So please do put questions if you have any in that chat function. Our staff is actively monitoring the webinar's chat function and will forward me questions that we will get to at the end of this question and answer period with our panelists on both panels. If we run out of time and are not able to answer your question, our staff is committed to following up with you afterwards, so please do ask those questions. I'm going to start by giving a brief background about the issue of COVID-19 and our correction system here in Connecticut. It's really important that during this time of crisis, the Governor of Vermont and lawmakers take actions necessary to ensure that incarcerated people, including youth who are detained or incarcerated in Connecticut, are protected from the virus. We know right now there are about 12,000 people incarcerated in our unified prison and jail system who are at serious risk. This is for a number of reasons. There are very close quarters in prisons. It's very difficult, if not impossible, to comply with these social distancing requirements and recommendations. There is known to be a lack of ready access to hygiene supplies. And even before this crisis, there was inadequate medical care in the system, which is strained even more now and puts people at a high risk from illness from COVID-19. Connecticut's prison population also includes many elderly folks and people with pre-existing health conditions who are at an even higher risk of getting gravely ill or dying from the virus. So as this crisis looms, we are really doing our best to keep lawmakers apprised of what are appropriate public health solutions to this problem. And there really needs to be a thoughtful and coordinated emergency response plan. So far, the ACLU and a bunch of other advocacy groups have advocated for, at this point, 3 or 4 weeks for that plan to come into focus. And we are still somewhat frustrated and pushing for that, and hope that today's 2 panels will help educate folks on this webinar as well as others about the need for that public health solution. To that end, we are hosting 2 panels today. The first panel is a panel that is comprised of medical and public health experts. Those experts will talk about the need to develop a plan to prevent the rapid spread of COVID-19 in our jails and prisons. And they'll outline some of the steps that we can take to do that. Our second panel is a panel of legal experts and experts in reentry and youth justice who will speak about the need for a coordinated emergency response from lawmakers. So we will get started with the first panel. That's the medical perspective panel. I want to start by announcing that, unfortunately, in light of the growing COVID-19 crisis, Dr. Puglisi, who is on the billing as one of the people on the first panel, has been called into the hospital this morning and regrets that she can't join us as previously scheduled. So I'm going to start by telling a very brief bit about myself, then asking our panelists on the first panel to introduce themselves, and then we'll get into some substantive questions. I am David McGuire, the Executive Director of the ACLU of Connecticut. I've worked at this organization for approximately 13 years. And over my time here, we have done a lot on prisoners' rights. And we've also been more recently very involved with the campaign for smart justice here in Connecticut, which is a campaign grounded in the belief that justice impacted people should lead the movement for decarceration. And we are transitioning some of that work into the COVID-19 crisis right now, which is why we are hosting this webinar and putting a lot of our resources into it. Um, Dr. Ben Howell, would you do us the favor of introducing yourself, talking briefly about your medical background and why you're on this panel today?
Sure, no problem. Thank you, David. And thank you for ACLU Connecticut for putting this together. So my name is Ben Howell. I'm a primary care physician. I am also a health services researcher, specifically researching the health impact of incarceration in criminal justice policy. I see patients at the West Haven VA and primarily see veterans who are experiencing homelessness. And then I am part of a postdoctoral fellow at the Yale School of Medicine. And just as a caveat to all that, to be clear, everything I'm saying today is my personal opinion and is not the views of my employer, specifically the VA and the Yale School of Medicine. The reason I'm on this call is because of my patients. So I see people all the time who have been in and out of the criminal justice system, either the jails or the prisons. And I just know that sort of what they experience and the healthcare and the risks of for their health in correctional settings clearly impacts them directly then, and then even when they're upon time of reentry, as well as I know that sort of the health of our people in our prisons and jails directly impacts the health of our public and communities, especially communities even more impacted by mass incarceration. And those are the main reasons I'm on this panel today.
Thank you for that introduction. Brian Sullivan, will you do the same thing and just tell folks a little bit about you and why you're on the panel today? Brian, I believe you're on mute. Let's see if we can unmute. There you go. Now you're off mute. Go ahead, Brian.
My name is Brian Sullivan. I'm an ACLU Smart Justice Leader. And the reason I'm on this panel is because I spent 31 years of my life incarcerated. 15 of those years, I was a hospice volunteer and a hospital aide working directly in the hospital units, both infirmaries for men in McDougal and in Osborne. And I know firsthand the challenges and obstacles they face on a daily basis when there's not a crisis. So I believe that I have a unique viewpoint into this situation, and I want to share that with everybody.
Thank you for joining us today, Brian. And our last participant for the first panel is Claudine Fox. Claudine, could you tell a bit about yourself and the perspective you're bringing to the panel today?
Yeah, hi all. My name's Claudine Fox. I'm the campaign manager for the ACLU of Connecticut, the Smart Justice campaign, and any other campaigns that we happen to, organize around. I'm on this panel for a couple of reasons. One, because the folks that I'm directly organizing with, formerly incarcerated folks, justice impacted people, are, currently experiencing the waves and the woes of what's happening to their brethren that are currently locked up right now. And additionally, I have a public health background. So I majored in public health in undergrad. And before coming to the ACLU, I was working for a health equity organization that focused on health policy and really evaluating systems of health, not clinical, including clinical health, but like community health and wellness, and how systems can really inform the community health and wellness of everybody. And so I am bringing that perspective.
Thank you for bringing that today. Dr. Howell, I'd like to start with you, and if you would just give a baseline about COVID-19. There's a lot of information online, on TV, some of which contradicts itself. If you could do us the benefit of just talking about how the virus spreads and also how it differs and is more serious than the flu.
Sure. No, David, I'd be happy to. I think one thing we should all acknowledge is that we're still learning a lot about this new virus that really 4 months ago, we didn't even know existed. So there's many, many things that are being learned every single day, and many people trying to figure that out. But what we do know now, that COVID-19, or the novel coronavirus, is a disease spread by viruses, and particularly a respiratory virus. It is related to the viruses that cause the common cold, but is clearly very different. And I think some of the main ways it's different is how serious it is and how quickly people can get very sick. the typical way people get sick is to have very serious lung infections or something called acute respiratory distress syndrome, or ARDS, where they just get to a point where their lungs can no longer function the way they should, and they need to be intubated or put on a breathing machine. Unfortunately, even with the most drastic measures, we'll still, unfortunately, a good number of those people will still die. I think what we know is that it originally started most likely in China, but the main point now is that it's all over the world and over all 50 states, and we just can basically assume that any community in America already has people with this infection in that community. I think a couple things that are important for thinking about the epidemiology or how this disease spreads is that not everyone gets seriously ill. That there are a certain number of people who will get the virus and be without symptoms. They won't have a cough, they won't have a fever, and yet they'll be carrying the virus and be able to spread it to other people. Another thing to know is that we think that it takes about 5 days from when you first get exposed to the virus until you have symptoms. So that's another 5-day period when someone could have the virus and be spreading the virus and not have symptoms, and there's no way to sort of intervene upon that person. The main way we think this virus spreads is from person to person, in particular respiratory droplets. So obviously, if someone is coughing or sneezing, they're clearly making droplets that sort of spread around them and will either land on their hands or land on objects or spread through the air. And that's where the sort of guidance around the best way to prevent spreading this infection is sort of being 6 feet away from other people. So that we think that when you are even when normal speaking, you make droplets that spread out, and that with gravity alone, it's sort of around a 6 feet perimeter that we think is the safe area where you will not be in contact with someone else who is spreading their droplets. The viral particles do remain sort of able to spread infection after they land on objects. So it's not even after someone sick has left an area or someone who has the virus has left an area, there's still a possibility that if someone else entered that area, they could acquire the virus themselves as well. So that's where hygiene comes in. Obviously, personal hygiene, washing your hands. If someone is known that they're spreading the virus, to have a mask on that person, and then cleaning sort of any sort of surfaces that someone who potentially is spreading the virus is touching. And I think those are the main things we know about how it spreads. I'm sure there's other things that we're still learning, but David, were there any other things that you were hoping to learn about the virus?
No, I think that is a really good baseline and really prompts a bunch of questions about the correction setting and whether that setting is one where we can really manage this effectively in terms of a public health response. So one thing I'd like you to bring out, Dr. Howell, is what the population is like inside prisons here in Connecticut, and whether there are in fact folks that do have pre-existing health conditions. You know that from the work you do with people when they're recently. Could you outline that a bit for folks?
Yeah, so something I forgot to mention earlier is who are the people we think are having the most serious consequences. I mean, first of all, anyone at any age can have serious consequences if they were to get infected with this virus. It's not like it's excluding people who are under any certain age. We're already seeing people at all ages, frankly, dying from this virus throughout this country and throughout the world. That said, people who are at higher risk are older adults. So anyone, I would say, over 60, but definitely over 80 is definitely at higher risk. I think the data was that 1 in 5 people who were showing up to the hospital with this virus, if they were over 80, were dying. So 1 in 5 were dying over 80. And obviously those people who didn't die were having serious complications as well, sort of being in the ICU, having serious deficits that they probably will carry with them the rest of their life. We think also anyone who has immunocompromised or the ability of their body to fight off infections is impaired in any way, they're at higher risk. And then anyone who has, and that can lead everything to people who have serious diabetes, people who have cancer, and there's a whole list of things. People who are on certain medications will have their immunity or ability for their body to fight off infections suppressed. And then probably people with respiratory diseases at baseline, so people who have asthma, COPD, are also probably at higher risk of developing serious complications. But again, just to reinforce, anybody at any age can have serious complications and die.
Thank you for that. That's really troubling. I think shows the need to really tackle this with a comprehensive approach. One of the things I'd also like to get your take on is the feasibility around complying with the COVID-19 suggestions around the hand washing, the disinfecting, the social distancing, knowing what you know about our prison system, what is the feasibility of really complying with that?
So yeah, I mean, I think the keys to addressing this and preventing spread are what we're calling social distancing, or frankly, it's physical distancing, not being sort of in contact with other people who, other than your immediate family, if you're outside of the prison or jail system. And that just doesn't mean other people who are incarcerated. That also means correctional officers. That also means other staff, like really anybody, trying to minimize those direct contacts to less than 6 feet. And then if you are in contact with people, sort of being able to implement hand hygiene and other measures to sort of clean sort of your spaces after other people have used them or have been in them. So therefore, sort of any congregate living situation or any situation where people are living together makes it very difficult to have those physical, sort of to create that physical distance, that physical barrier we need to spread between other people. And then just basic having access to hygiene materials, having soap basically is an important thing. And I know that is something that in most correctional systems that has to be purchased through a commissary and is not directly accessible to people who are incarcerated. And I think the other part that I would think about is the ability of the system to quickly recognize people who are infected and then quickly move them out of sort of the ability to contact other people. And that's just something that correctional systems aren't set up to do, to quickly recognize people who are sick, quickly escalate their care if needed and get them potentially to ICU level care, and then sort of be able to quarantine and move people around a system. I think what we know, although we're learning more about the coronavirus, we can think about lessons learned from other outbreaks in correctional settings. That's, for example, when there were pandemic flu several years ago, really correctional systems got hit very hard. And we know that this is worse than the flu. And yet even correctional systems had trouble managing those outbreaks at that time. So we can say, like, absolutely, we're already going to see spread in correctional settings, much like we are in the community.
Okay, that is helpful to know. One of the things that we're concerned about is ready access to not only the cleaning materials and the hand washing, but also to medical staff when someone does come down with it. And we know this from previous instances of work that we're doing, that there's already a shortage of medical health care staff in the correction system before this crisis. It seems like some of the folks that are medical staff will probably, themselves get the virus in the community and maybe not be able to go to work. Do you have concerns about the internal capacity to meet these medical needs?
Absolutely. I mean, I think our hospitals and clinics in the community are frankly already worried about that. I can't imagine a system that's already stretched and running bare bones, being able to sort of make up those deficits if nurses, if correctional officers, if other folks are calling out and being able to sort of manage outbreaks. Because absolutely, I mean, I think what we know is that people who are going to get sick can get sick very quickly. And it's not something where they can sort of put in a sick call and sort of be seen in a day or 2 days time. They need to be seen within an hour, within 6 hours, and not being able to do that could lead to sort of unneeded or preventable serious outcomes. And that does bring up one other thing that I want to mention that I forgot to mention earlier, is that absolutely, it's not just the people who are in the correctional setting. The virus doesn't discriminate between correctional officers, medical staff, and people who are incarcerated. So any people moving in and out of the system can bring the virus in, can get the virus spread between them. So the fact that medical staff and correctional officers are moving in and out of the community is another way that, number one, they can get sick as well, but then also that they're going to be a way that this virus sort of gets in and out of the correctional system. So very much any of the health and the outbreak in a correctional setting is going to sort of only make the outbreak in the community even worse.
Well, that actually hits on a point that I wanted to bring up, both with you and other panelists, the point of new people coming into the system, not just healthcare workers and corrections officers, but people that are arrested and put into the system as a pretrial detainee. Is that something that scares you, particularly in light of the fact that you mentioned earlier that people are asymptomatic for the first several days of having this?
Yeah, I mean, I guess there's no way to know. I mean, it's going to be a gamble every time someone is entering the system, whether they're carrying the virus or not. I mean, because not everyone's going to have a fever, not everyone's going to have a cough. So absolutely every time of anyone being booked into the system, any correctional officer, any sort of medical staff coming in and out, absolutely, I think there's an opportunity for that person to be bringing in the virus anew. That said, even though sort of with the normal screening protocols, everyone does get a medical evaluation when they enter the jail or prison, but it's not a very efficient, at least my understanding is not a very efficient system at baseline, that those people need to be sort of, so obviously people who are sick are more likely to spread more quickly. So those people need to be evaluated right away and sort of quarantined right away. And the system is just not set up to evaluate and screen people that quickly. So absolutely, people coming in is a way that of all sorts who are going to bring in the virus.
We'll bring out more about this in the second panel, the legal panel, but that is a real concern we have. And we and other advocates have been pushing for the last couple of weeks to try to slow or eliminate new people coming into the system for that very reason. The last piece I want to take up with you, Dr. Howell, is the quarantine piece. I don't know how feasible it is to really quarantine people in that system, particularly when the virus potentially can run through the system like wildfire. But one of the consequences of quarantining in a correction setting is it's tantamount to solitary confinement, which itself has a public health impact and long-term consequences for people. Could you unpack that a little bit for us?
So yeah, absolutely. I mean, I think prior to the current moment, our correctional systems over-relied on solitary confinement for a variety of reasons. And prior to the current moment, there was a big push to reduce sort of the usage of solitary confinement in our correctional settings. Because absolutely, I think it is, for me personally, it sort of meets the standard of cruel and unusual punishment that people in solitary sort of have adverse consequences when they're in solitary, but we know from growing data that even after they're released, their risk of dying from various, typically from mental health, suicide, overdose, those sort of things are much higher than people who are not exposed to solitary. So absolutely, even before this, we should be thinking about ways to reduce solitary. But the fact that the correctional system is going to say we're going to use the one tool we have, which is solitary and lockdown, to treat this public health outcome is just adding harm upon harm, and I think is an inappropriate use of solitary confinement.
Thank you for all that information, Dr. Howell. I mean, I think it's really clear that the system has to figure out a way to depopulate in a smart and coordinated way to reduce that risk inside. Brian, I'd like to shift over to you. Brian, I think that you can do something which will be very valuable to the folks tuning in by giving a snapshot or viewpoint into what healthcare is like in the corrections setting, because I think a lot of folks really don't have an idea about that. So can you start by telling us a bit about what the experience is like of being someone that is sick inside our correctional setting?
So again, having spent 2/3 of my life incarcerated and a vast majority of that time working directly in the medical unit, I've seen firsthand on a daily basis what happens. And I want to make this very clear that I'm not here to throw the nurses or the doctors under the bus, but the fact is that when there's nothing going on in the system, when there's not the flu that's running rampant on a regular day, they're overwhelmed and their resources are limited. So when something comes in, it spreads like wildfire, as you already mentioned. And they get so overwhelmed and they want to help, but they just can't because the resources aren't there. The obstacles and the barriers that they face on a daily basis, never mind when there's a pandemic, is crazy. So when someone gets sick inside, as Doc spoke to, and I'm sure a lot of people know, you have to write a request. Now, I'm sure at a time like this, maybe they're trying to see people a little bit faster, but they're limited. They can't do it. Like, they don't have the space. There's 2 infirmaries for men, one in McDougal and one in Osborne. One's a level 4, one's a level 3. They have limited rooms and they have dorms there. So when someone gets sick and they believe that they have something that can spread, they sometimes will put them in a 0 pressure room. But you only have 3 0 pressure rooms in the state. So therefore you can't contain it. So as soon as someone comes up to an infirmary that is sick, everyone up there is getting it. It's just the facts. That endangers staff, that endangers those that are incarcerated. It puts greater people at risk. That of the CO who has to be there to directly take count, the nurses who have to deal with the individuals directly, the CNAs, the hospice volunteers, and then the other patients who already may be sick from something else are going to be susceptible to catching whatever this individual has. Once Corona enters, that's it, it's going. It's going worse than wildfire. And there's nothing they're going to be able to do to stop it unless they act now and do something in a safe, secure manner to reduce the population, to get those out that can go out. Because other than that, there's going to be major problems and people are going to die.
Can you unpack a little bit more what it's like to file a medical request in the system? I know you said it takes a while, but can you kind of paint the picture of the structure there and the fact that folks in the system really don't have ready immediate access to the doctors or telehealth as people do at home?
All right, so I get sick or something's the matter with me and I'm in my block. I file a request. I drop the request in the medical box. Medical staff, there's sick call that's scheduled for every unit. And sometimes it's normally twice a week for a unit, right? For, a couple hundred people. The medical staff will get it. They'll assess the necessity of the need of that individual. They'll call that individual down. They'll see what's going on. But that's not seeing the doctor. That's seeing a nurse. And then they'll determine if you're going to see the doctor, right? So when there's serious situations, when we had the MRSA outbreak, when the flu came in, as Doc was talking about earlier, there's only 4 or 5 doctors for a whole prison. And that's at full capacity, and they're definitely not there. Mm-hmm. So I don't know what they're doing now, but for all the years I was in there, a lot of people would not get seen. And you know what happens after that.
Well, I can tell you, as someone that did legal work for the ACLU before I became executive director, a lot of our work had to deal with people that were not getting the medical or mental health care that they needed. And again, like you say, that was at a situation that was not a crisis level pandemic. So we do have real big concerns. Thank you for kind of painting that. Tell me a bit about what you think quarantine would be like in the system. Are we right in saying it would be similar to solitary? And if so, what are the downsides of that?
All right, so because of what's happening right now, they're locking the facilities down, and I know this firsthand, right? A couple individuals that I know that are in there, family members and I know that they're just locked down, right? So they're quarantined to their cells, very limited movement, as the governor put out. He didn't want more than 10 people associating. So they break the tiers down into the amount of people that could come out at one time, right? So I don't think I would associate it so much with solitary confinement as when you're in your cell, you have, your personal stuff there. Whereas when I was in solitary confinement, you don't have anything, right? And you definitely have hygiene material and you're lucky if you're getting toilet paper. But being that they're doing it now, they're doing the whole facilities. It's definitely detrimental because at the end of the day, being stuck in a cell all day, day after day and doing nothing, it plays on the mind. You're already incarcerated. You're already dealing with issues that led you to incarceration, and these issues aren't being met. And so now here you are with another individual because there's very limited single cells in the Department of Corrections. So they're doubled up, and you have to deal with this day in and day out. And it could be very, very detrimental to the overall population because it could definitely cause something that can really explode.
Quick question for you and Dr. Howell. We've heard a lot about air quality issues inside Connecticut correctional facilities. In terms of a lack of clean, fresh air, you can't just open a window like you could at your house, for example. Is that something that you recall being an issue, Brian? And then Dr. Howell, is that something that concerns you around the spread of this virus potentially, as we're learning more about it?
All right. Well, so if we look at for the most part, most of the facilities are central air, and I don't know how that plays into the virus spreading. Osborne is not. Osborne is an older facility, one of the oldest facilities in the state, and they, for the most part, they have the majority of the population has windows in their cells that they can open. But with that being said, it's still an older facility. It's not the cleanliness, the cleanest facility in our state. So I'm sure that plays into it as well.
Yeah, David, I definitely think the real question is we just don't know. There's a lot of uncertainty right now about how the virus spreads. I mean, most likely it's going to be sort of droplets where you have to be in relatively close contact and 6 feet of someone and or sort of touching something that they recently touched. That said, we do know that there are times when it sort of gets airborne or gets aerosolized. So if someone's very sick, coughing a lot, there is an opportunity for the viral particles to spread more widely than just the 6 feet around them. So absolutely, I mean, that's why we use negative pressure rooms, as Brian brought up, to sort of just control the airflow in and out of that individual room. And you just can't do that for larger units. You can't create like a negative pressure unit. And I can tell you that the hospitals are already thinking about this, where they're only putting sort of patients with COVID all on one unit so that it's not spreading around that hospital unit. So you can imagine if hospitals are worried about it, our correctional settings should be worried about it as well, because we just don't know. There's a lot of uncertainty, and likely most of it's droplet, sort of closer contact, but certainly a certain amount of it is going to be airborne and sort of shared air spaces or shared air systems. There's an opportunity potentially for spread that way as well.
Thank you for that. Brian, one last question for you. You had mentioned that you know some folks that are still inside. What is the impact of this crisis for someone whose family member is inside? I mean, I know that people that are have control of the situation outside are worried about their loved ones. Can you paint a picture for us of what it's like when someone's in the setting right now?
Well, I can tell you from personal experience, like just going through a regular lockdown, when you don't have access to visits and limited opportunities to speak to your family, you already dealing with a lot of pressures as it is. And then this comes and this plays on you, and this hurts, and you tend to lash out, right? Because it plays on the mind, you know? So I know that there's no visits right now. And something else, just to go back real quick, something else that Doc said, and you mentioned as well, is that, you know, like staff as well. Now, staff is in there and they're worried about it, so they're not showing up, right? So that's limited staff. That also limits the movement. So even if they said, okay, we're going to do rec for 10 people, if limited staff are coming in, which is, I'm sure, what's happening, then that also is going to reduce the amount that they offer to those incarcerated, right? So now you're not getting visits, right? You're limited contact, limited movement, and this plays on you as well. And that definitely affects your mental health and your physical health.
Thank you for that. I really appreciate that. Claudine, moving over to you. I mean, it's very clear from the two panelists so far that the proper public health solution for this is depopulating our system and finding ways to get people to safe environments and make the correction system as safe as possible and as less burdened as possible. Can you tell me what must happen for that approach to be successful?
In order for the kind of plan we're looking for, where depopulation within our facilities to be successful, it needs to be a coordinated response, right? So when people think about public health, I think we often focus on the word health in the phrase public health and not so much the public side of it and kind of what goes into public health, right? So it's taking a larger systemic look at how all of our systems, meaning our food justice system, our housing system, our education system, our medical and health system, and our prison system, how they all interconnect and kind of circulate with each other. And so I think in order for a depopulation approach to be successful, the impact that COVID-19 is having on our people that are currently incarcerated in our prison systems, we need to be at the table and talking about a coordinated public health response. 95% of people that are currently incarcerated go home, which means they are going back to our communities. They are coming back home to be with their families, to be integrated back into their lives. And so if we're thinking about, currently there are 12,000 people locked up, and of that, there are over 300, over 400 of those folks that are 60 years old and older. And of that, 6,000 people have less than a year on their sentence, which means they are coming home in less than a year. So if we are not approaching this from a coordinated response where we are taking into consideration housing opportunities for folks, healthcare opportunities for folks. Those folks are coming home anyways. So why wait and prolong this outbreak, this pandemic? Why not just do something now?
That makes total sense. Thanks for highlighting that, because I think, folks are really not thinking about all the players that need to be involved to make this successful. As you mentioned, a coordinated response. It seems very much so far like it's a siloed or very segmented effort, if any, together on this issue. What do you think the role of lawmakers have to be if we're going to be successful in this? Everyone's focusing on Governor Lamont, and clearly he can do a lot through executive order. But legislators, what do you think they should be doing or aware of right now from the public health angle?
I mean, legislators should also be at the table, should also be pushing Governor Lamont to release a plan. And they should be listening to their communities, honestly. If you really take a step back and look at advocates and community organizers and folks that have been speaking for weeks about the impact of this illness, stepping into your role, Smart Justice always says everybody has a role in ending mass incarceration. And nothing brings, some of our systemic disconnects to light like a pandemic or an emergency situation.
Right.
And so that means really not being afraid to lean into the sticky, to lean into the conversations that feel uncomfortable at first, and really come to the table and show up for all of your constituents, not just the ones that are on the outside.
Question for you, Claudine, and also Dr. Howell. When people are released, I take it, Claudine, you're saying they need to have services provided to them when they get out, so they don't go from one bad situation to another and create another public health crisis. Can you elaborate on that a little bit? And then, Dr. Howell, can you talk about the need for real continuity of care when people get out? Because I know that that's been an issue in the past that you've done a lot of work on. Probably going to be an even bigger issue in this pandemic.
So from a public health perspective, a health equity, health justice perspective, people don't end up locked up just for fun. It's often out of survival, right? People are already trying to meet needs for their families and for the community that aren't made readily available to them due to, societal issues and, things like racism, whatever. And so, folks don't end up locked up, like I said, just because they want to. And if we don't pay attention to the gaps in, basic human care that led people to be in our prison systems, that doesn't mean that those gaps go away when they come out. So what does it mean to correct those wrongs, right those wrongs, and make sure that people are going home to full and healthy lives that include some kind of housing plan? We can't make the assumption that everyone that's locked up has a home to go to once they're free, right? And we can't make the assumption that once somebody comes home that they have a job that provides health insurance. And so again, really taking into account all of the systems that allow a person to be happy and healthy, which is access to healthcare, access to a roof over their head, access to some kind of education, access to income that provides the basis and opens the doors for all of those things. If we're not thinking about all of the systems that create the opportunity for a person to go into our prison system, we need to be thinking about it at least from a reactive point of view.
Dr. Howell, before we get to you, I just want to remind the audience that we have the capability to take questions. So please put those out there. We're going to get to them in the next 5 to 10 minutes. So please put those in the chat and we will get to them. Dr. Howell, can you talk a little bit about the continuity of care and that need for that net when people get out?
Yeah, David, I would just want to echo and sort of amplify everything Claudine has already said. Absolutely, we can't think of sort of, yes, we need to depopulate and decarcerate, but we can't, if we just sort of push those people into the community, we're just pushing off that risk in time and potentially putting people in sort of dangerous situations. I mean, in the best of times, a lot of people do not, as Claudine mentioned, don't have homes to go to, so they're ending up in shelters, they're ending up in sort of halfway homes, facilities like this that are similarly not set up to deal with this type of public health sort of crisis. So we can't be doing that. We need to be sort of thinking very proactively and holistically about sort of when people leave, where they're going to go, whether the places they're going to live. Absolutely, we need to think about sort of continuity of healthcare. In sort of other times, we know that release from prison and jail is a highly morbid, sort of potentially fatal event, very destabilizing for many people. So the risk of dying, as I said, in the normal period is sort of 13 times higher than the general population in the best of times. I can't imagine in a time when our healthcare system, our housing systems, sort of our whole social safety net is being sort of really pushed to the limit, how much higher that risk at reentry is going to be. So absolutely, sort of getting people sort of continuity of care, especially if they have chronic diseases, and also sort of insurance. Luckily, we're in a state that expanded Medicaid, but absolutely we need to proactively getting people on Husky and getting them hooked up with sort of healthcare clinics. I think just sort of thinking in the public health perspective, that if we just push this population out and they get sick from anything, coronavirus or anything else, they're just gonna already stress an already very stressed healthcare system in the community. And so we have to very much think holistically about how to do this well, do it quickly, do it smartly, and do it sort of as a whole system, thinking of all those pieces together. Because if any of those pieces is failing, it's going to affect and infect sort of the other pieces of that system.
So want to put this out there for everyone. It sounds like the kind of collaborative approach and resourcing people when they get out for housing and things of that nature, medical care, are really important. Obviously, this costs money. As we understand it now, there are all four caucuses of our legislature and the governor are working in a coordinated way to come up with some kind of a COVID-19 stimulus package or response package. It seems to me that it would be very, very important to include funding for these vulnerable communities that are coming out of this system. Can you talk to that first, Claudine, and then the other panelists weigh in on the need to resource that?
Yeah, again, you know, in the calling for an inclusive, compassionate, and proactive, and at this point, I don't know if we can even say proactive plan, you know, there does need to be money behind this. You know, programs, like Dr. Howell said, programs are stressed already. You know, we live in a society where our you know, safety net, our safety net systems are stressed and working on this kind of grant funding, things like that, that can run out and kind of leave people in danger. And so what does it mean for the lawmakers and legislators to lean in and really step into their power to create a stimulus package that addresses these human rights issues?
Yes, absolutely. I agree. I mean, in the best of times, sort of for my patients who are vulnerable or disenfranchised, getting them housing, getting them sort of employment, getting them a telephone, which is going to be important, all getting them healthcare is all very difficult in the best of times in a system that's already sort of even now in extreme stress. Absolutely. I think part of the answer is obviously coordination from the state to help these systems all work together better and more efficiently. But absolutely, it's going to require stimulus and just frank money to be spent.
Brian, any thoughts on that in terms of the need for those resources when folks are returning home?
Absolutely. And there's two things that I want to mention. It's something numbers that Claudine brought up. And one, it seems to me that, you know, different governors and lawmakers and people overlook the number. And it's been the same number, the 95%. 95% of those incarcerated are coming home. They are coming back to the communities. They are going to be your neighbors. And if they don't allocate funds now that help them individuals, they're going to pay more in the long run, right? The numbers support this. This isn't something I'm saying because I was incarcerated and I'm mad at the system. These are the numbers the experts say. And the other number that Claudine brought up is about how many individuals are under a year are going to be released. From all the professionals on every network talk about how COVID-19, how it's only going to get worse, right? We don't know how long this is going to go on. So individuals are going to come to the end of the sentence every single day from now to a year, and it's going to keep going. And they're going to come home. If they come home and they're sick because you don't do something today, then you're just going to perpetuate the problem down the road, and it's going to be so much worse. Resources have got to be there. IDs have got to be made available for individuals getting out of jail. Doc talked about a phone, health. All these things should be addressed. And I do know DOC does address IDs prior to leaving. Everyone doesn't get it. I know I got mine. I was very proactive in the system about getting it. I was adamant. I wasn't letting up because I knew I was coming out here and I knew the adversities I was going to face. But everyone doesn't have that inside, like, especially now going on, because I'm sure the counselors are limited. I'm sure staff is limited. So money has definitely got to be allocated. There needs to be more resources so that these individuals can succeed, so that the problem can diminish. And if we don't do it now, it's just going to be a bigger problem down the road.
You're right. Urgency is really here. So we're going to turn it over to questions now. We had a lot of great questions. Mel Medina from our office is going to read those out. There you go, Mel.
Hey, David. Can you hear me? Just want to make sure. Yeah, great. So we'll start with the first question, which is coming from Ryan Lindsay, which I believe is she's with Yala WNPR. Ryan Lindsay asks, Dr. Howell, you said something along the lines of correctional institutions aren't set up to quickly identify who's sick. I imagine she's referring to COVID-19. Can you explain why that is?
I'll defer to Brian because he knows sort of more intimately how our correctional systems are set up to address getting people sick. But my understanding is, as correctly as Brian said, that you sort of put in your sick slip to try to be seen, and that hopefully will be honored within 24 hours. I just don't think that's fast enough. And then if they're understaffed and the system's stressed, maybe that even takes longer. So people who are developing a cough, people who are having fever or any concern, they need to be seen quickly, like within an hour, so that that can be addressed. They can be potentially cohorted. They can potentially get into healthcare. So I think those are part of the reason. Also, on the sort of intake side, sort of just the screening, like yes, everyone gets a medical screening, but honestly, I think that is sort of inefficient and sort of probably not needs to be ramped up, if anything, to correctly sort of identify people who might be infectious. But I'll lean on Brian and his lived experience more so than my understanding of the system.
And as Doc said, he's definitely right. So, with limited resources, for one, you're writing a request. It's almost impossible for them to see you within 24 hours, right? It's just not happening, right? It's not feasible. And who knows how long it's taken now with limited staff. And on the intake side, anytime you enter a new facility or you enter the correctional department, period, you get a quick intake, right? So they ask you a couple questions and they take your vitals, and that's it, right? And then you're put into population, right? So I don't think, in my opinion, that they're equipped for this. I agree with what Doc said. Everything he said, he knows his stuff. They don't have the resources to handle this.
Thank you. We'll move to the next question, which centers on the conversation around depopulation, so that you don't have the density issue, so that perhaps there can be some social distancing. This question says, tens of thousands of beds in dorms at state universities are for the most part now currently empty. These universities have modest healthcare facilities and commercial-sized kitchens. Would it be an intelligent and thoughtful move to move incarcerated people out of prison facilities into these now empty state universities?
I think Claudine can speak to this as well, but I know that there have been active conversations about that. But I think, number one, if someone has a home, just send them to their home. Send them to their family. That's going to be the best place where they can control their environment. They can be with their loved ones through this very scary time. They can support themselves. So if someone has a home, get them home. For people who don't have a home, yes, we should be thinking very sort of holistically about what are the places that aren't shelters, that aren't halfway homes, where people can live during this time and sort of have their own space, ideally have their own bathroom and access to food, sort of healthcare, and all those other things.
Another question. Yep, sorry.
Oh, no worries. I'd echo what Dr. Howell says. I guess my immediate thought goes to all of the steps and the resources that would need to be sunk into making sure that that was done efficiently and effectively. Like if we are, the notion that there, as far as we know, there are 2 people that currently work within facilities that are infected now. Like, what does it mean to actually accurately get people tested? What does transportation look like? What is all of those, like cleaning, the facilities, because we don't know students from the university who had stuff before they were like finally evacuated from schools. Part of me just feels like that is more complicated than just releasing folks, like, as Dr. Howell said, to their homes if they have them.
This next question is about thinking critically about larger institutions and their role that they can play. The question is critically thinking about the pervasiveness of structural violence within the context of public health. How can big institutions such as Yale support the collective fight? How can we leverage certain institutional powers during this time?
Money. Invest money into accurate and thoughtful and connected solutions that, again, take into account all systems, all access to systems. Yale, money.
I agree. I mean, I think Yale, any of our large institutions need to step, and they need to sort of do more than just lip service. And this is a time in a crisis when the rubber hits the road, and they just really need to put their money where their mouth is and sort of really step up. Because absolutely, if they don't, it'll just perpetuate and sort of make sort of structural violence, structural racism that they have been sort of guilty of, and up until now, now's the time to step up to the plate.
Okay, the next question that we have, sorry, just finding my place here, has to do with the role of Governor Lamont in light of this pandemic. This question is referring to specifically what plans are in place. Well, first the question's asking, is DOC releasing anyone right now? And then it follows up by asking, what are the plans, if any, to address a looming pandemic within prison facilities?
I could speak to the release piece. We know from publicly available statistics that there are about 400 fewer people in the unified system than there were at the beginning of this month. And that is more than triple the amount of reduction that we've seen in recent months of March. The confusing thing is that there's really mixed messaging from both the DOC and the governor's office on the reason why that's happening. We really need institutions and individuals to put pressure on the governor's office to be very clear, transparent, and have that thoughtful, decisive plan to depopulate in a way that people understand and that is actually followed through on with resources after. So I could speak to just that part. Anyone else want to tackle the rest of that question?
I mean, I think the answer is we just don't know. And I think that's where, David, I 100% agree. This is a time for transparency. I mean, in the best of times, our correctional system is a Byzantine, opaque system that's hard to change and very slow moving. It just needs all change. It needs to be very transparent, very open. The DOC says they have a plan. I trust they have some plan, but we don't know what it, at least I don't know what it is. It has not been very clear what their plan is.
We've got two more, the last two questions that we can take, and apologies to folks if we weren't able to get to your questions. We are attempting to follow up after this webinar. Our staff are committed to following up with you. The first question relates to lawmakers. Where might legislators access additional information to help press for a measured plan? One challenge that I am seeing is the tendency of the general public with no understanding of systems, making this an us and them issue in times of scarcity. How can we support legislators in making the case?
Share this webinar link with them to start with. But there is actually a lot of information both on the ACLU of Connecticut site. We have a COVID-19 response page with a couple of detailed letters outlining the specific laws that are already on the books that the governor and the DOC commissioner can use to relieve the pressure on the system right now. But I think just having conversations like Claudine said with your constituents is most important, because legislators do have an important role to play here, but during the governor exercising this emergency authority, it's important that the folks around him at the Capitol, not physically right now, but who can call him, put pressure for a response now. because the governor is uniquely qualified to pull together and marshal the resources from all those different agencies, as Claudine and all the panelists spoke about. That's going to be the key, that coordination, which we're just not seeing at all right now.
And then the final question, what can Connecticut learn from the responses in other states and from the Federal Bureau of Prisons in regards to releasing incarcerated people to protect them from contracting COVID-19?
Go ahead, Claudine.
No, go for it.
Well, I guess we don't know. I mean, this is happening so quickly. It's hard to know what, I mean, we hear the public reports on what other systems are doing, but honestly, I think, yes, we need to learn from each other and try to all sort of learn how to coordinate and be as quick as possible and just get people out. I mean, I think obviously not putting new people in the system, getting people who have shorter sentences out, getting people who are at higher risk out, and those are the type of people we should be getting out.
And to add to that, right? So we know that there's blocks inside right now that have an enormous amount of level 1 inmates, which are already community release approved, right? So they're just either waiting on a halfway house bed or a sponsor or something of that nature. So if they're already community release approved, we can start there at least, right? Then you have a whole bunch of individuals that are held on minimal bail, right, for very minor crimes. And we need to start somewhere. So I understand everyone, you know, especially up top, they want to look at safety and security. That's the favorite line that trumps everything else. But safety and security, if COVID-19 enters, which is gonna supersede anything they're talking about now. So if we started with level 1 inmates and we got all them out, that would reduce the population and open up more space, right? Those held on minimal bails and those higher at risk.
Yeah, what I would also, oh, sorry, Claudine, you go ahead.
Oh, no worries. I was going to say, I would just, I watched a press conference a couple days ago where the governor mentioned that he really likes to, speak to the bordering states, about like their responses or how they do things. And I think what he can do and learn from our neighboring states like New Jersey has already started releasing folks, is talk to them about it and not be afraid to have these conversations. And what I think is happening is that we're turning our backs on, a section of residents that actively live in Connecticut, our constituents. We're turning our backs on them and we can't do that. And so, it's a call for the governor to lean into that difficult conversation and to really start to listen to activists and advocates on the ground about, what Brian just said. If there are 6,000 people that are going to be released within a year, what's the plan for that? We need a plan. We're in crisis.
Yeah, absolutely, Claudine. I mean, there's a need for Governor Lamont to be brave and decisive here. This has been done in red and blue states. This should not be a partisan issue. This is about human life and public health. A sentence in prison is not a death sentence. So we need to learn from that and really get something done now. Just last night, Attorney General Barr put out a memo urging the Federal Bureau of Prisons to release folks, particularly elderly folks and folks that are infirm. How is that happening at that level, but not here? So I'll leave it there. I want to thank everyone for being part of this panel. I think it's given us a lot of great background and makes clear that there needs to be releases to make this work, to really reduce that risk. And that folks need the resources when they get out. We're going to pause for a brief 5-minute break while the next panel queues up. Please stay on the line. That next panel is going to talk to the rights perspective. So we're going to have people that are attorneys and activists that will speak about the next step of legally how we tackle some of the issues now that we know what the public health situation is. So I appreciate you all and just hang in there for about 5 minutes and we'll get back started up.
All right. Thanks a lot.
Thank you.
Thank you.
For folks on the line, please hold on. We'll be starting up in a few minutes. We're just waiting for our other panelists to join, and then we'll go right into our next panel, which is based on or focused on the rights perspective and the perspective of directly impacted people. So give us a few seconds. For folks who are just joining, just give us a few minutes while we take a small break before we start our next panel. For folks just joining our call, just stay on the line as we queue up for our next panel. And for folks just joining the call, just stay on the line as we queue up for our next panel. For folks on the line, just stay on hold while we queue up for the next panel. We're waiting on one more panelist to join us. All right. David, I think it makes sense since this panel is divided into two sections. One, the kind of legal perspective, and then two, the perspective of reentry from the voices of people that not are just directly impacted, but can speak to systems when they work well and not work well. While we're waiting for our last panelist, I think we should first move forward with a brief explanation of what this next section is for the folks on the phone to understand,
Sure.
and then jump into the legal perspectives.
Excellent. So thank you all for staying with us or tuning in for the second panel. This panel is going to focus on the rights and response perspective around releasing people to protect them. We just heard from three really dynamic and thoughtful people that gave the public health perspective around why Connecticut needs to depopulate the prisons in response to COVID-19 and how that approach needs to be grounded in public health. Meaning, this is not a punitive or carceral system. This is one that's trying to make sure that people are kept safe, which is one of the duties that we have to people in our system right now. Part of protecting people from COVID-19 in prisons and jails means that the response must be coordinated, robust, and thoughtful. And we need to figure out a way to do this as quickly and safely as possible. So now we're going to hear from a panel of legal and rights activists about what really needs to be done and what mechanisms we could actually employ to get this done. I'm going to go around the horn and have folks introduce themselves as we did in the last panel. So please, if you'd all give 1 minute about your background and why you're on this panel. Tennille Bonilla, could I start with you from the Connecticut Juvenile Justice Alliance?
Yes. Hello, everyone. As you said, my name is Tennille Bonilla. I am a justice advisor for the Connecticut Juvenile Justice Alliance. So I am on this panel today because I've already been working with the Alliance on other things that have to do with the COVID-19 crisis and releasing the kids. From the beginning of this week, I've been working with them. We sent out a letter, I did an op-ed, things like that. This topic is really significant to me. The work that we do has to do with working on trying to get kids released anyway, trying to prevent them from being there, and obviously working on reentry. So this just put another sort of like stamp and highlight on the importance of what we were already working on.
Thank you, Tana. I appreciate that. Chris Rapillo is the Chief Public Defender for Connecticut. Chris, could you just tell a bit about your background and why you're on the panel today? You're muted, Chris. Hang on. Mel, are you able to unmute Chris? Okay, Chris, you're unmuted now. Could you give us a little background about yourself? No, you're fine.
So I'm Chris Rapillo. I'm the Chief Public Defender. So I'm responsible for all the public defenders' offices across the state. I'm on the call because we have the people on the front line in the courthouses every day working to minimize the number of people coming in. And that's why I'm here. Thank you for being here during such a hectic time. Dan Barrett is the legal director with the ACLU of Connecticut, one of my colleagues. Dan, could you talk a little bit about why you're on the panel today?
Sure. Good morning. I'm Dan Barrett from the ACLU. And what we're trying to do in the ACLU, both in the courts and outside of the courts, is to figure out a way to get people out of harm's way immediately, because the people who are in prison, as we heard from this morning's panel, are just sitting ducks. And so we're exploring a variety of legal options to release the maximum number of people that we can. And I'm looking forward to chatting about that today.
Great. We also have one other panelist that we're waiting on, Daryl McGraw, who, when he joins, we can loop in, but I think we should just get started now.
David, actually, Daryl's with us. I'm gonna unmute him and.
Oh, great.
Daryl, can you hear us?
Hi, you guys can hear me?
Yes, we can, Daryl. Thanks. Could you just give a brief introduction of yourself and why you're on the panel today and why this issue is significant for you?
Sure. Yeah, I couldn't, I don't know. I guess you guys don't want to see me. I couldn't, for some reason, get my video up. I'll keep trying. So my name is Daryl McGraw. I work at the IMRP, the Institute of Regional Policy, Municipal Regional Policy. And one of the things that I wanted to say is that I'm a formerly incarcerated person. I spent 10 years of my life in and out of the Department of Corrections, and I'm currently working at the IMRP as the senior reentry analyst. And one of the things that we work with is we work with the Connecticut Reentry Collaborative that is made up of 10 reentry roundtables across the state. So I'm hoping that we can talk about the work that we've been doing at the IMRP here in the state in reference to reentry reform.
Absolutely, we can get to that. So Ten, I wanted to start with you. Can you give us a insight into what you think a plan from the government needs to look like around protecting young people in the system?
I'm sorry, did you say my name?
Yep. Yeah, could you just talk to what you think a government plan has to look like to really protect young people that are in the system right now?
So I feel like first and foremost, the government should definitely start with providing support. So that means support even if we have to keep certain kids in these facilities. So, medical support, continue serving them information about the COVID, don't leave, them out of the important things that are going on. Make sure that there are protocols being followed within the facilities, especially with the staff, because the staff are coming, in and out of these facilities. I also think that I obviously do agree with the fact that the government and the governor himself should work on releasing more kids out of these facilities. I think it's obviously really important to make sure that the ones that we want to release are not being a risk to the community. So each individual has needs that are going to need to be met. And throughout these individuals, they're going to have to make sure that they are, like I said, making sure that they are not a risk to the community. And I feel that if they're not, then they should definitely be, brought back home. Lessening the number of people that are in these confined facilities would definitely benefit the risk of it spreading within the facilities. Because not only is the staff coming in and out of there and possibly, bringing stuff, but there's facilities themselves aren't that clean. So you can think about the inmate themselves being in their cell by themselves, which probably isn't that clean. So that doesn't really work. And then they're also maybe in these common areas with a bunch of these other people that also kind of doesn't work because there's too many people in these areas. I feel like it's really important to make sure that we are so worried about ourselves in this outside world and our neighbors and all the people that are being affected by it. And I feel like it's responsibility of us to push the government and the governor to make sure that the people that we're working to try to get released, or even if they're not able to do so, that they're still getting that same support and that same help and that same want to make sure that they're safe the same way that we're doing out here. We have youth in there who also suffer from maybe diabetes or any other things that compromise health. That's a really big group of people that I feel like we also need to focus on.
Yes.
Obviously, nothing about what we want to do will be easy. So following certain things, like just trying to start with that group of people, or starting with people we know have a release in the near future, or people who are going through pre-trial, like these groups that we may find, I guess, slightly easier to work with because of the situation that they're in. Those should be like our main focus, but obviously our goal will always be for everyone to try to help prevent them from getting into the system, trying to help them get out of the system, as long as the rest of the community is affected.
So just picking up on a couple of things that you said that come out of the first panel. One is around quarantining young people in those facilities. Obviously young people are even more susceptible to the harms of solitary confinement. Paint a picture of what that might be like if they really start to lock down even more. And in your opinion, is that a consequence we should try to avoid by releasing people rather than putting them in that kind of a solitary confinement situation?
Yeah, absolutely. I don't agree with the solitary confinement being a thing during this pandemic. And I feel like another thing to definitely work on is to try to avoid bringing more people into these facilities. So not only making sure that we try to work on lessening the number that's there, but we don't want to replace the number that we're trying to lessen with a new number. We don't want to replace the bodies that we want to help with new bodies. So part of that would definitely be trying to, again, as long as they're not a risk to the community, prevent even bringing people into the facilities during this time.
And thank you for that. And you spoke to the need for medical care for folks in the facility.
Yes.
Can you speak to what that is like as a baseline generally before the COVID-19 outbreak, and what you think that crisis might do to the accessibility of medical care to the young people in the facilities?
Right. So the young people in these facilities, unfortunately, they suffer from a huge lack of medical assistance within these facilities. From my knowledge, it seems as though they are not even really provided with medical assistance or care unless it's like, completely urgent or something. I feel like there should be this constant, just nurse or something helping every day. And especially during a crisis like this, it's really important not to lack any of that. We're working so hard to make sure that everything, again, out here is those type of things are being provided. We're testing people out here. We're making sure that, everything is that we have access to all of those things. So we need to provide that same thing for them, even if it's just somebody in there making sure that they're getting checked every day. Just that consistency would be really important because there's a big lack of that right now anyway. And I feel like that needs to be pushed because obviously during this process, we're not going to be able to take everyone out of these facilities or as much people as we would like to. So it would be really significant to make sure that those people that are not going to be given that equal opportunity are still provided with that within the facility and taken care of, and making sure that they're trying to go through the same lengths to protect the health of those incarcerated as they are not.
Thank you. Thank you for lifting that up. The final piece I wanted to just touch on with you is whether, in your knowledge, folks that are in those facilities are getting access to their loved ones and support networks outside. I know it's a really scary environment, and I was wondering if you have any insight on that or any suggestions about that.
So one thing that I do know right now is that visitation has been taken away. So I know that right now the inmates only have access to their families through phone calls. I do actually have a suggestion about that. That's one piece that's actually kind of significant to me. As we are aware, a lot of the youth in these facilities already go through struggles just being in the facility without people, such as things that affect their mental health. And having a lack of communication and relationships with their families also does affect that. I understand the need to limit the people that are coming in and out of the facilities, and sort of limiting the amount of people that are going to be in one space at a time. But I do suggest that they start doing things such as maybe staggering these meetings or having more private visitations to sort of help both sides of the equation, because I feel like that's a mental need for the person who's incarcerated, but there's also safety that's needed for everyone within the facility. And I feel like doing things like staggering or making those things more private will benefit both sides of that. I don't think that it's necessary to cancel meetings as a whole, nor do I think that it'll be beneficial for anyone who has to remain in confinement.
Thank you. Attorney Rapillo, I'd like to move over to you and ask you the question about pretrial needs of folks. So, there are right now about 3,000 folks in our correction system that are pretrial right now. In your view, what does the government's plan to protect those people have to look like? And can you outline some of the options for making sure that those folks are kept safe?
Sure. So I think that the first response has to be that we have maximum protection of people's due process rights. And, right now in Connecticut, we still have in-person arraignments with live lawyers. No one's on telephone calls. There's some video conferencing, but not for people entering. And that's the best chance of getting people released, is having people get access to attorneys who are going to be in court live with them, being able to talk to them and to make their arguments. I think trying to keep the hearings as local as much as possible also helps. It's easier for families to get to court. People have a better knowledge of what limited resources might be available. And I also think with due process, some of the rules of court have been modified to give the judges power to take longer to do things. And I think we in court have to try to do what we can to make sure that they don't use those modified rules, that we stick to arraigning people quickly, getting probable cause findings made quickly. I think we've got to work to eliminate intake as much as possible. And I think a lot of that is happening. Some of it's happening on the ground with law enforcement. We're seeing that people in lockup arraignments, the total around the state has averaged about 25 or less statewide, which is down significantly from what you'd see outside of the coronavirus time. We know that the reports that I'm getting from my field offices is that most people, not everybody, are being released or getting some sort of a quick favorable disposition, because people really are working to get people out from the beginning to limit the intake. And I know our attorneys are using COVID-19 as an argument to try to get people out. They've got templates, they've got motions, and they're doing things like that. I also think, though, it's important that we try to keep the treatment of everybody as individualized as possible. We spend a lot of time trying to fight the system from treating our clients as one kind of amorphous entity. There's not very many services that are out there, so we've got to know folks. We've got to be able to try to match them up with what limited amounts of services are out there. Our social workers are still coming to work, still trying to match people up with whatever might be available. And my understanding is that they're working to try to get some ability to put people out into programs within the next couple of weeks. So if admissions were stopped and people were able to be quarantined, they may be able to reopen up beds because they'll have the ability to put people in without putting folks at risk. So I don't have too many details about that, but I know it's been discussed. And, a mass release like what happened in New Jersey sounds good, and I think there's categories of folks that we need to be looking at, but there's a lot of concern about where are folks going to go. people need services, and everybody says we need to let everybody out, we need to give them everything they need, but we didn't have that in our court system before. So I think trying to keep everything individualized will give us the best chance of getting people out and making sure they have what they need. One of the efforts that's being made now is there's a list of people who are held on just misdemeanors and violations of probation. Those are going to come to our offices and to the prosecutors, and they're going to get an individual review to see how many people can be gotten out. So it's not a mass release. It's not going to be like New Jersey, but it is going to be a review of at least that first layer of cases, you know, people who probably shouldn't be in there anyway, to see whether more folks can get out. And again, I think continuing to do emergency motions for folks that have been in, that aren't new admits, that have been in and maybe medically compromised or, you know, otherwise ought to be able to be considered for release, ought to be happening. So, I mean, that's kind of what's going on now. I think the idea of the thing we've been fighting against the most is having people get video conference lawyers, because I think that doesn't really provide a lot of due process for anybody. It makes it really hard to make good arguments and to get all the information from your clients about what you can do in order to get them out.
Yes, that absolutely puts them at a disadvantage. And Attorney Rapillo, I believe that Daryl, when we get to him, will speak to the need for real reentry resources and that we have an opportunity here. Aside from funding those resources through a potential, you know, state package that's going to come out, are there any other suggestions that you have for an infusion of funds that would help your clients during COVID-19?
Well, I think housing, other people have talked about that. Housing is critical. I was on a call with corrections, so these folks that were mentioned in the last call that are level 1 and just about ready to be released, you have to have a sponsor. You've got to have a place to go. So there's folks that don't have a place to go. And if we were able to identify housing for people, then it would be much easier to get people out, and I think people would do better, because we want to get them out and then we don't want them to come back. We want to get them out and then sort of be supported and be able to not re-enter the criminal justice system.
Right. I want to remind all the folks that are tuned in that we are still taking questions through the chat function on both platforms. So please send those in, and we will do our best to address them with the panelists during this presentation. And if not, we will get back to you after. Dan, could you pick up the thread from Attorney Rapillo on potential solutions for the pretrial population, or folks that are being processed and being put into the system, in ways that we might prevent that?
Sure. So you can think of the pretrial population as the upstream part of the prison population. So these are people who've been arrested and who the state contends should be detained prior to the date of their trial. And I think the easiest way to keep people out of, out from in front of the COVID-19 steamroller is to keep them out of a prison facility entirely. And so one way to do that is to change the way that we look at pretrial release. You know, in Connecticut, we've had a lot of discussion over the last few years about when it is that people merit being detained prior to trial, but the numbers have not changed very much, notwithstanding all of that talk. And so, although individual judges are exercising their discretion and being very wise about thinking hard about whether a person deserves to be in, what the ACLU did last night was to ask the Superior Court Rules Committee to temporarily modify all of the rules relating to pretrial release to say that the default is that the person doesn't have a financial condition on release, which you might know as bail or bond. People who get bail or bond in many cases cannot afford it, and that's the only reason why they're in prison, is because they can't come up with the money. So an easy way to keep those people out of prison in the first instance, because I think if you remember from the panel earlier, Dr. Howell talked about how people rotating in and out of prison can cause a big problem. A person coming into the prison can bring the virus with them, or they can be exposed to it when they get into the prison. And so to the maximum extent we keep people out, that's an important part of slowing the spread of the virus in prison. So we're asking the judiciary to consider modifying its rules. And as Chris Rapillo said, we want individualized assessment. So we want, every time a person goes in front of a judge, for the judge to really think about, is it wise during this pandemic for the person to be held for lack of money, or is there some other thing that we can do to ensure that they make their court dates?
That's really helpful, Dan. Switching gears to the sentence population, folks that have already been adjudicated, what can the government do to respond to their needs and keep them safe?
So the government, I mean, that's, you know, the executive branch. So the governor and the people who work for the governor have a lot of options. Again, you know, you would want to kind of target these things, but there are many options for the government to decide to let people out. And those run from, you know, starting at the top line, the governor in Connecticut has a state constitutional ability to grant what's called a reprieve. So a person who's been convicted can be granted a temporary reprieve from confinement by the governor until the next legislative session occurs. That's one option. That's you know, a really easy and somewhat painless way of doing things. But there are also a number of other things. The DOC itself has the ability to release pretrial people under certain conditions. It also, as some of the folks who have gone through incarceration have mentioned, there are some programs, for example, furlough. There's transitional supervision. These are all programs that are designed, you know, pre-pandemic to get people reintegrated when they're coming home from prison. But those programs have not necessarily accelerated in the face of the pandemic. And now is, you know, I think probably the time to think about accelerating them. Certain kinds of cases, the DOC can release a person directly to home confinement. So for certain, you know, so-called low-level cases, there's also, you know, work and education release that's available. So there are a range of options. As Chris Rapillo mentioned, it's important that the state have some kind of plan. It's not very clear to me at the moment that there is a plan for using all of these levers to try to get people out. You know, we have, including pretrial population, about 13,000 people a night who are caged in Connecticut, and getting as many of them away from the pandemic is going to be really important. So from my own view, what I'm looking for is some kind of unified theory, some kind of plan by the government to use all these layers to get people out.
Well, yes, that's absolutely necessary. I mean, based on the first panel and what we're hearing so far, there's real consensus that getting some folks out of the system is something that has to happen sooner than later, and that coordination is going to be important for that. Question for you and Attorney Rapillo on remedies that folks may think about individually. Obviously, there's lots of advocates pushing for the governor and the legislature to make a big plan that's going to really address this. But in the meanwhile, or short of that, are there things that individual folks that have incarcerated loved ones can think about doing or advocating for?
So I think to the extent that folks are close to the end of sentence or maybe eligible for parole, people can be assisting their loved ones get through that process. I mean, my understanding is that they haven't changed their eligibility for release at DOC or parole, but they're trying to kind of release more people under the statutory reasons they have to release people now. So if there's assistance people could do in helping their loved ones put their paperwork into parole, if there's information that would help them if they're at the end of sentence and they need a place to stay. So my understanding is that they did another reach out for people who were getting close to end of sentence but didn't have a place to go, and they were able to increase the releases by 20% just by re-asking the family. So if you could be a resource for somebody where they could live with you, that would be a way to help speed it along and at least get some individual people out.
Thank you for that. Any thoughts on that, Dan?
Yeah, so there are a couple, you know, there's sentence modifications that people can ask for depending on their own situation. And if there's a pretrial for the folks who are being held on bond, there is a bail modification procedure, and a lot of that is going to be individually driven. So if the person has a reason to say, look, I have a place to go, I have not much time left, that kind of thing, this is the time that they may want to explore that.
I think that's important because the public defenders were given some template motions, particularly for folks with medical emergencies. people may be having trouble getting a hold of the public defender's offices. Courthouses have been consolidated. It's skeleton crew. I know I was the person answering the phone in New Britain earlier this week, and while I could answer any call that came in, I didn't know how to get into anything that had been left in the queue. So I think people are going to have to be a little persistent and a little patient with trying to get a hold of the attorneys in the offices and trying to get the information. You know, bad comes to worse, they can call this office. We're doing our best to get things answered. But I think people just have to be a little bit persistent. If you've got information about one of your loved ones where there could be a sentence modification or a bond reduction, to keep on trying. And the sentence modification, the only caution on that is for most of those, you need the prosecutor's consent to even get those back in front of the judge. So we are working on trying to, the chief state's attorney has been pretty good about at least communicating with us. And so we are going to see if we can get some of our folks, a group of our folks working on that just to try to make it more organized, because we will need to get a hold of prosecutors in order to get those sentence mod motions back in front of judges.
Great. Question for you, Attorney Rapillo. Are you saying that in-person arraignments that have been going on are more effective than the virtual format in terms of decreasing the amount of time people, the amount of people that are heading to jail?
I absolutely think that. Technology is no substitute for being able to talk to a person. If you have to do it by video conferencing, the attorneys have very little ability to have confidential communications with the clients. I think people don't share as much of their information when they don't have a face-to-face relationship where you can build trust with somebody. And I think it makes a difference when you have a live person standing in front of a judge in a courtroom. And it's not just a face, no offense to the Zoom meeting, but, for a court proceeding, having to see a real individual person in front of them makes it more human. And that's the most important thing.
That makes a lot of sense. Following up on that, have you or any of the folks in the Office of the Public Defender found difficulty communicating with your clients during this crisis that are inside the facilities?
So corrections has been continuing to allow professional visits. They'd rather that we don't come in, but they've not told us that we can't. And they have been good about letting people make legal calls. I've not heard that people have had trouble getting access to their clients. Now, I don't know how the clients who are inside trying to get a hold of us are doing. I think we're able to get in touch with the people that we need to get in touch with. I don't know that they're having as easy of a time. I don't know how that is for them trying to get in touch with us. They may have access to the phones and they may have trouble getting through to somebody in our offices because of the skeleton crews.
Understood. Darryl, I want to move to you now that we understand some of the legal landscape. I know that you're really an expert in reentry, and I'm hoping you can paint a picture for us of what reentry looks like right now amid the COVID-19 pandemic, and why that is a problem if it is. I think you're on mute, Darryl. Are you there, Darryl?
Hello?
Yes, now we can hear you.
Can you hear me?
Yes, thank you.
Yeah, technology is a challenge sometimes. So I appreciate the opportunity, and I appreciate the ACLU for having me on. One of the things that, and I really appreciate, just being a part of the conversation, because so many times we have these conversations without people with lived experience being at the table. So having reentered numerous times from the Department of Corrections in many different situations, I want to go back to just speaking real quickly about the lived experience, having been incarcerated when 9/11 happened and being locked down, and having been incarcerated when there was a health issue, when we had a stomach virus in Walker, and all of us were locked down and we weren't able to use the phones and so on and so forth. So having that experience and understanding what those individuals are going through in there, now being on this side of the fence and actually working with the IMRP, the Department of Corrections, as well as the Connecticut Reentry Collaborative, is an opportunity for us to build this bridge. And listening to the speakers today, and as well as the previous speakers on the first panel, I just want to reiterate that we do have a reentry collaborative, a Connecticut Reentry Collaborative, which I encourage and invite everyone to be a part of, because not just because of the pandemic, but this should be a conversation. Reentry should always be a topic that we're all at the table having this conversation, because as one of your colleagues stated, 6,000 people are incarcerated right now with less than a year to come home. So those individuals are coming home, and we all know that 95% of these individuals are coming home. So at some point in time. So knowing that and having that knowledge, working together to make sure, not just during the pandemic, but all the time, that we're working to make sure that people have a safe place to transition to. So right now, those individuals, there's a lot of advocates that we have who I love dearly, but are advocating for instant release. But instant release for where? Right? We want to make sure there's no way that I would ever advocate for people to come home, especially in the midst of this crisis that's new to all of us, with no safe place to go. So I think that that's something that we should be having that conversation, and those resources should be put to that. I just want to add one quick thing, Dave, is
Sure.
the fact that there's a lot of, I think I was misquoted in an article where we talked about using the universities for transitioning people who are still doing time. And that wasn't part of a conversation that I was part of. That conversation was for those individuals who are EOS, end of sentence, who have no place to go, and the shelters are at capacity. The one thing, if I was a person who was at the end of my sentence today or tomorrow, and knowing that I had no place to go, I would be, that would be a terrifying situation for me. It's one thing to be getting out of prison homeless, but then to be getting out of prison with all the doors closed is a bigger issue. So I appreciate the time.
Right. So I know for many, many years, I've known you to advocate very loudly for more reentry resources, Daryl. Given the gravity of the public health emergency that we're going through right now, tell me, if you were able to marshal some resources in that stimulus package that we talked about, where would you say the greatest need for resources are right now in terms of service? We've heard housing, we've heard medical care, things of that nature. Can you give us some perspective on that?
Oh, definitely. I think that we would definitely be talking about streamlining the services and making sure that people's needs are being met all the way around the board. So just say hypothetically, if we were to use the EOS population, let's just talk about the EOS independent population. If we're releasing those individuals to a college dorm per se, and then connecting them with community health workers and making sure those individuals are okay health-wise, and then addressing the needs, whether it be IDs or what have you, sort of a triage location for those individuals to be met, and then slowly bringing them into the community once housing and all these other needs are met. I mean, people being released without an ID or any of those things that they're being released with, those are the things that we need to be addressing up front, making sure that before someone is released back out into the community, everything that they need is being met. And that's one of the things that the reentry roundtables are focused at, and this is why I'm going to emphasize that more and more, that there are 10 of them around the state. We need to be coming together and having those voices there so we could actually, when something like this happens, we already have a strategy.
Wonder if you could elaborate on whether those reentry roundtables are still electronically active during this crisis, because
100%. We're actually talking to numerous people on the reentry roundtables around the state. We have conversations pretty much daily. One of the things I would like to emphasize is that for those of you that don't know, there's a reentry website, www.ctreentry.org. That's being updated. We're actually that reentry roundtables have been the focus and have been actually making sure DOC has up to date on real live information, if something's closed and if the shelter's closed, and it's the roundtables that's doing the work, making sure that if something's going on in Wyndham, we know about it. If something's going on in Norwich and in London, we're getting information and we're feeding it to DOC, but we're also putting it on the reentry website so individuals can go there to check to make sure, if there's a food bank open or closed, they can actually access that information right there. And we encourage individuals that are on the website and all of our colleagues that are around, even the individuals on this call, if you have information, you should be putting it on the reentry website, because we are focused on that 95%. Every day, pandemic or not, we're focused on that 95% coming home.
Thank you for all you're doing, Daryl. Dan, to bring it back to you, hearing what Daryl just put out there, do you have any kind of unifying thoughts of both the legal end of it, but also the policy end and what needs to be done here?
Sure. So first, I guess, to echo what everyone else is saying, that this is a deeply unusual time and in a very dangerous situation that we're dealing with. I think with respect to the state and its response, we are talking about hours, not days. And so if the state is going to do this thoughtfully, I think the thing to do is to move very quickly and to identify slices of people who are incarcerated who can be released. And I'd almost say that in this case, transition planning has to happen, but it really doesn't need to hold up the release of people. It can happen simultaneously. So, for example, I think given what the physicians have told us, and if you look at the letter that the ACLU submitted to the Superior Court Rules Committee, it's pretty alarming that I think, for example, holding somebody in for an extra couple of days because they don't have a driver's license right now during this crisis is probably not the thing to do. So the reason that the ACLU is sounding the alarm for the executive branch is that it doesn't seem like there's a plan at the moment, but I think there could very easily be a plan in which the state says, okay, there's this slice of people, they could all go tomorrow, let's make that happen. There are a variety of legal mechanisms in place to help that. And of course, everything has to be done with compassion. So for example, a person who raises their hand and says, I don't want to go, I don't have anywhere to go, or there's a problem for me on the outside, obviously I'm not going to force that person out. But I don't, in DOC terms, the ship turns very slowly, but this is not a time for the ship to turn slowly. This is, a full-blown crisis. And so the state really needs to act now.
And have the resources to do it. That sounds right. Ms. Bonilla,
Yes.
just circling back with you, because we've really focused now primarily on the adult population, but in light of everything you've heard, are there commonalities or things you'd like to raise that are specific to the young folks in facilities across the state?
You guys hear me?
Yep, we can.
Okay. Sorry, just having a little bit of trouble with my laptop.
We're all getting used to the digital world.
So there was just one thing that I kind of wanted to touch base on, which was the conversation that we're having about making sure that people are prepared for being actually released. I know that is a wide concern for all inmates, but I do understand that it actually happens to be a little bit of a higher concern for juveniles because these juveniles aren't, adults. They can't really care for themselves.
Right.
So we would expect them to want to go back into safe homes, responsible adults, etc. My colleagues have actually highlighted that's one of our big concerns, which is making sure that that support goes through them being released and into safe homes and being provided with resources to do things such as continue with education, possibly get employment, things of that nature. I also feel like something that we've highlighted with everything that I feel like pertains just as much to juveniles as it would adults, which is we know that there's money being fueled into other areas such as small businesses and corporations, etc. And I think that knowing that kind of tenses us up a little more because we would love for some of that to be taken and put into the support and the resources that we want to provide for processes like this.
Thank you for lifting that up. I mean, I think the real takeaway and the thread between both the panels is the need to come up with a comprehensive, collaborative policy to start getting folks out with the resources that they need. We are winding down on time, so Mel, I'm going to turn it over to you to ask some questions from the audience.
Sure. The first question will be for Dan and Chris. What should law enforcement agencies, police and prosecutors, be doing to be proactive about protecting people from COVID-19? And I think that question is in light of probably populations coming into prison and out of prison because of arrests.
Sure. Hey, so I don't want to cut off Chris, because she knows 1,000 times more about the criminal litigation system than I do. But the Connecticut allows police the option of giving people summonses. And so, for example, not making a custodial arrest of the person and demanding that they appear in court, but giving them a ticket and a piece of paper that says you have to be in court on this particular day. That has to be used incredibly widely now. So the police just ought not to be taking people into custody and either setting bond for them or holding them overnight. And the same for prosecutors. I think it is incumbent, the fire alarm has been pulled here. And so it's incumbent on them to think about, is it really important to ask for, in unreasonable bond, knowing that the person isn't going to be able to pay it? Because every person who goes in, you're really exposing them and their loved ones to a real dangerous situation. So for the police, I think it's stop making custodial arrests unless it's absolutely necessary. And Chris probably knows of other options that they should be exploring.
Chris, if you're trying to speak, you might have muted your own phone.
Can you hear me?
Yeah, we can hear you now.
Okay. So I think some of that's already happening. We've seen the number of custodial arrests drop off precipitously, but we're still seeing people who come into court who are being released at court, and it would be better if those people never made it into the court lockups in the first place. So I think that's someplace maybe law enforcement can continue to assess. People should be getting summonses. Nobody should be getting into court and being released on a PTA because they should have never made it there in the first place. Those that do, I agree with Dan. People shouldn't be held unless they present some sort of high risk to public safety and there's no other options. I think the message has gone out to courts to do that, and it's happening in most cases. It's certainly never going to be happening in all cases, so more needs to be done.
One more question for you, Chris, because I know you have to jump off fairly soon. This one's coming from Ryan Lindsay with WNPR. A bit of a technical question. Approximately how many people are present during an arraignment now, given the circumstances in light of COVID-19 and the skeleton crew of your field team?
So when I was in New Britain the other day, because that's the only court that I've been in, there were maybe 10 people, and that included marshals because they were bringing people out of lockup. So there was a defense attorney, a prosecutor, the clerk and the court staff, and there were a few, there were observers in court. There were audience members in court that day, so there was maybe 10 people. I think that's about average. We're not letting there be more than 5 people in any of our offices at any given time. I think the prosecutors are doing the same thing.
Thank you, Chris. And if you have to jump off, feel free to just go ahead.
I do. I've got to go do my call with my supervisors, but stay in touch. If there's other questions that come up for me, get a hold of me later this afternoon, and I'm happy to answer them.
We will do. Thank you so much.
Bye-bye, everybody.
Bye. The next question seems one great for Daryl. What do you think the role of residential halfway house programs can play during the current crisis as beds are emptying out of DOC, is filling that back up as a means to release people from DOC facilities. But does this help in equipping the residential and halfway house programs make room for possible quarantine? So it sounds like what they're generally asking is the role of residential and halfway house programs in light of a crisis and the depopulation of both DOC and halfway houses, so that should quarantine happen, they would, there would be more space available.
But that's a great question. I think though, we've happened to have had a few calls with people from the halfway house and residentials, and they're strapped too. What they're asking for, and they're on the other side, and they're saying that, listen, we're still getting people day in and day out coming out of DOC, right? So because people are being released to them, they don't have the opportunity to make a space for them if those individuals that are in the halfway house currently, if they get infected, they don't have a place to quarantine them. So they're trying to figure out a way that if they could slow what's coming to them, then they could actually set aside some beds maybe even a house, which is strictly quarantined for residential and halfway houses. So here's this other side of the coin that a lot of times we don't know about, right? So they're strapped. They're saying, look, we don't have room to quarantine like a guy that is not releasable. They don't want to send him back because he's sick, but if they don't have the space to house him in their facility, what happens next? So there are some challenges. So what we would like to see, the halfway houses do make that space, but if there is an opportunity for them to take somebody out, do so, but also coordinate with parole and probation for those individuals, especially individuals on special parole, to be releasing anyone that can be released. Absolutely. We should, with those people, anybody with a month left or whatever, or already has approved housing, their sponsor's been approved, those individuals should be released automatically. That's almost a no-brainer.
And this is related, and I'll paraphrase it. This one's asking about, there's an active conversation, at least that journalists are reporting on, that the legislature, either through legislative action or through executive order, is likely to release some form of a stimulus package. And the question that was asked was about resources available to people to support them if released. Could you speak to the need for whatever stimulus package comes out of our Connecticut legislature or by way of executive order, what we need to be thinking about in terms of COVID-19 and releases of people from prison and the reentry community and what they need?
Sure. I think that, number one, if we were to just say, let's just use $100,000. If $100,000 came out, was released from the legislator, I think that we should secure a state building especially for EOS. Individuals that are coming home, we should secure a building, a space that these individuals can be quarantined for the 14 days, make sure that everything that they need, that health-wise are addressed, number one. Number two, whatever their needs are, whether it be if we can provide them with identification or get the ball rolling for successful reentry to start, that would start in that building process. Then we would connect with I'm thinking of individuals that are homeless, because if they are in need of housing, then we're going to make sure that we will connect with the Coalition to End Homelessness. We will connect with them, and then another portion of those resources will go to them so they can put those people in successful housing after all their needs have been met. Well, what's happening is we're just releasing people and everyone's saying release, release, release. But you know what? You put somebody in a situation that has nothing, no resources, nothing to not even an ID. And now they're walking around and the stores are closed, the streets are empty. They can't even go to the soup kitchen. So we need to make sure that we provide everything possible, even setting up, these almost like a triage location for these individuals to transfer to, so we can make sure that they're successfully reintegrated back into the community. So we need to be using those resources to secure a spot for those individuals.
This last question has to do with the population in DOC. The question's asking, who's the what are we talking about in terms of people in hospice, in the hospice unit, or with serious medical conditions in DOC, or with immune deficiencies, and I would add age in there. I would direct this question to Dan. You've done some work about understanding the existing DOC population in light of COVID-19, and then I think this would be an opportunity to also wrap Dr. Ben Howell back into the conversation around what you describe and then from the medical perspective, what that means.
Sure. So for DOC overall, we have 13,000 people who are held in cages every night. And just in the pretrial population alone, we have 400 people who are at or over the age of 50. We don't have any data, obviously, because of medical privacy, about who's immunocompromised. But we know there are people in prison, for example, who have hepatitis C, who have HIV. And I would note that even in the best of times, as some of the panelists this morning talked about, DOC has trouble addressing, or I should say has chosen not to address, things like hepatitis C, which don't spread nearly as easily as COVID-19. And so those people are really in great danger. I would say for the lawmakers who are listening that, no choice is an intentional choice. And the decision not to act right now is not something that happens by accident or not something that nobody has time for. It's a decision to leave people in harm's way. And so for the folks who are most danger here, we really need to act.
Sorry, Mel, I just joined back in. I agree with everything Dan said, but is there anything I can quickly add?
Yeah, I think, we know that it's an existing population with existing medical issues. For the folks that might have just joined this last panel, if you could just speak to what are the proper public health solutions that we should be considering as a state right now for the incarcerated population?
Sure. Just to reiterate, I think what we're learning, I think there's been some sort of, I would say, sort of misinformation about sort of who's at, sort of everyone is at risk. People sort of from sort of age 0 up to 100, there are people who are getting very seriously ill and dying. Yes, it's more common if you are older, but just sort of to put that out there that everyone sort of is potentially at risk of having a serious infection and dying during this current pandemic. But absolutely, people are older, they're gonna sort of, their risk of dying can be up to level like 1 in 5 or 20%. We are still learning sort of which other comorbid conditions are going to make that risk higher, but absolutely we suspect immunocompromised conditions, sort of respiratory conditions, heart conditions, things like that are going to make the risk of having serious complications or death much higher. Just to sort of ram it home, like absolutely, I mean, as we all know, sort of physical distancing, get people sort of they're not sort of within 6 feet of each other, have regular hand hygiene, but also cleaning any surfaces, people not sharing bathrooms, not sharing spaces, and then quick recognition and triage of people who are sick so that they can be appropriately treated, because this can escalate very quickly and people can get very sick very quickly.
And not to put too fine of a point on it, Dr. Howell, but those precautions that you just talked about are very difficult or impossible to do in the correction setting, which is why I think there's a pretty thorough call on both these panels for a meaningful plan to decarcerate in a way that is responsible.
Absolutely, and I would just lean into all the people with lived experience who've been on these calls, that when there have been other sort of similar outbreaks, the DOC had a hard time managing them, sort of as flu outbreaks, other things like that. And this is even worse, and is it going to even spread faster? So absolutely, just we know that they're not set up to handle what is about to happen or is already happening, frankly.
Do you have any other questions, Mal?
David, I think that given the time, we've run out of time to ask questions. I think we should wrap up.
Yeah, so I want to thank everyone that has been on the panels and also who's tuned in. We had a lot of folks that really stuck with us. I find it very difficult to believe that people that listen to this call don't find this to be compelling and that there's a real public health emergency here. Again, we are calling on the governor and lawmakers to come up with a public health grounded emergency plan to get people out in a responsible way where they have the resources they need when they come back to community. A couple of action points that you might consider. I had more than a couple legislators text me while this is going on who have been watching, who say, please reach out to them. Legislators are still getting their emails. They get them on their phones and remote desktop. So please reach out to them if you're compelled by any of the narrative today. Additionally, the ACLU of Connecticut has a COVID-19 landing page, which has lots of resources, many of which are devoted to this particular issue of the healthcare crisis in the prisons and jails. On that page is also an action center where you can send an email to Governor Lamont and his top administration to urge them to act on this now. I can't stress the urgency of this enough. We really need to get this done now. So I appreciate everyone being with us today. Please do check back, as this will be cataloged as a recorded video with closed captioning, and share it widely. Thank you so much.
Thank you, everyone. Thank you to our panelists.
Yeah.